Hey there. You've got a ton of info on Ketotifen. And let's be real, those allergy eyes probably have you wanting answers now, not another medical school lecture. Luckily, we've got you covered. Today's deep dive is all about getting you up to speed on Ketotifen, what it is, how it works, and most importantly, how to use it effectively. And to help us unpack this, we've got our expert here who can explain all the technical stuff in plain English. What's fascinating about ketotifen is that it's not your typical antihistamine. It actually tackles allergies on two fronts.
That's right. It's kind of like a one-two punch for allergy relief.
Huh.
On one hand, it blocks histamine, which, as you know, is the main culprit behind those itchy eyes.
Yeah.
But here's where it gets really interesting. Ketotifen also stabilizes mast cells.
Now I know what you might be thinking. Mast cells.
These cells are key players in your body's allergic response. They're like little storehouses for histamine and other inflammatory chemicals. When you encounter an allergen, say pollen, it triggers these mast cells to release their payloads, causing those oh-so-fun allergy symptoms. Think of it this way. Imagine a beehive. If something disturbs the hive that's your allergen, the bees, those are your mast cells, get riled up and start swarming, stinging, causing a ruckus. Ketotifen is like calming those bees down, preventing them from going into attack mode in the first place. So it's not just about blocking the stings, the histamine, but also about keeping those bees nice and calm. Pretty cool, right?
That's really cool. So not only does ketotifen block the effects of histamine, it also helps to prevent those effects in the first place. And here's something else you might find interesting while you've probably reached for the eye drops. Ketotifen also comes in an oral form, usually as a tablet. Why?
Really? I had no idea. It's true. Now, these tablets are usually prescription only and are typically used for preventing asthma attacks in children. It goes to show you that ketotifen has a broader reach than just those itchy eyes.
It does make you wonder about how it works on a deeper level. But let's get back to the reason you're probably here, the eye drops. You've probably seen a million different brand names at the pharmacy. Zetager, Zyrtec, Itchy Eye. The list goes on.
It can definitely feel like a marketing overload. But what's interesting is that a lot of those itch relief brands are essentially just ketotifen with a different label.
So it's the same active ingredient, just packaged differently.
Exactly. But regardless of the brand, the key is knowing how to use the eye drops correctly to get the most out of them.
Absolutely. Let's talk about how to actually apply the eye drops. It might seem straightforward, but there are definitely some do's and don'ts.
First things first, wash your hands thoroughly. You don't want to introduce any unwanted germs into your eyes. Then make sure that dropper tip is clean and clear of any residue. Once you're all set, tilt your head back, gently pull down your lower eyelid, to make that little pocket and look up.
So aim for that little pocket with the drop, like a little eye drop bullseye.
Precisely. And remember, one drop at a time is all you need. Don't go overboard thinking more drops equal faster relief. One drop in each eye, if needed every 8 to 12 hours, should do the trick.
Yeah.
And after you put the drop in, make sure to close your eye gently for a minute or two. This allows the medication to spread evenly and absorb properly.
It's actually a good excuse to give your eyes a little break from screens, which we could all probably use a little more of. But let's be real for a second. We need to talk about side effects. I know nobody likes to hear about them, but it's super important to be informed.
Right. It's all about finding that balance between getting relief and being aware of any potential downsides. So let's unpack those potential side effects.
From what I've read, the good news is that most side effects from ketotifen eye drops tend to be pretty mild.
Exactly. We're talking about things like
Oh.
a little temporary stinging or dryness in your eyes. It's like a small trade-off for getting rid of that awful itch.
It's good to know those minor discomforts are usually nothing to worry about.
Right.
But it's important to be aware that in rare cases, some people might experience more serious allergic reactions to the medication itself. And those are definitely not something to ignore.
Yeah. That's where things get serious. So let's unpack those potential reactions and what to do if they happen. While rare, it's possible to have a severe allergic reaction to ketotifen called anaphylaxis. This is a life-threatening condition that requires immediate medical attention.
So what should someone be on the lookout for? What are the warning signs?
The main things to watch for are, a skin rash or hives, swelling of the face, tongue, or throat, difficulty breathing or feeling dizzy or faint. If you experience any of these symptoms after using ketotifen eye drops, call 911 or get to the emergency room right away.
Absolutely. It's always better to err on the side of caution when it comes to allergic reactions. Speaking of being cautious, what are some important things to consider before even using the eye drops? I'm thinking about things you should discuss with your doctor beforehand.
It's always smart to have a conversation with your doctor or pharmacist, especially if you have any allergies to medications. They'll be able to give you the green light or suggest alternatives.
And it's not just about known allergies, right? There's also the potential for drug interactions.
You got it. It's amazing how many medications can interact with each other, even those over-the-counter remedies or other eye drops you might be using. Always best to double-check with your doctor or pharmacist to avoid any unexpected surprises.
And let's not forget about our contact lens wearers. This is important for you.
Absolutely. If you wear contact lenses, remember to take them out before putting in your Ketotifen eye drops and wait at least 10 minutes before putting them back in. You don't want to irritate your eyes or get the medication trapped on the lenses.
Okay, so we've covered the basics, potential side effects, precautions, but I know there are always those practical questions that come up when you're actually using a new medication. So let's tackle some of those FAQs. First up, what if you accidentally miss a dose? Do you double up the next time?
Definitely not. If you miss a dose, just take it as soon as you remember. But if it's almost time for your next dose, don't try to play catch-up. Just skip the missed dose and continue with your regular schedule.
Got it. Consistency is key, not cramming in extra doses. Next question, storage. Can you just toss that bottle of eye drops in your purse or keep it in the bathroom?
It's best to be a little more mindful about where you store your Ketotifen. Keep those drops in their original bottle tightly sealed and store them at room temperature away from direct sunlight or heat. And of course, like with all medications, keep them out of reach of children and pets.
It's always better to be safe than sorry. Now for a question we hope nobody ever has to ask, but it's crucial to address. What happens if someone accidentally overdoses on Ketotifen eye drops?
While a serious overdose is unlikely with eye drops, it's essential to be cautious. In case of a potential overdose, immediately contact your local poison control center or seek medical attention. They can guide you on the best course of action.
And speaking of being cautious, let's address something else that's super important, sharing medication. It might seem harmless, especially with something like over-the-counter eye drops, but is it ever okay?
This is a hard no. Sharing is caring except when it comes to medication. What works for one person might not be suitable for another even if they have similar symptoms. It's always best to consult with a healthcare professional to get personalized advice and treatment.
It's like they say sharing is caring except when it comes to medicine.
Right. It's always best to play it safe and get personalized advice. Well, we've covered a lot of ground here today, from the unique way Ketotifen works to those precautions and everything in between. Before we wrap things up, any final thoughts you want to leave our listeners with?
I think the biggest takeaway is that knowledge is power. Understanding how your medication works, both the good and the bad, helps you use it more effectively and safely.
It's about being an active participant in your own health. Don't be afraid to ask questions. Read those labels carefully and advocate for yourself.
So well said. And while Ketotifen can be a real lifesaver when those allergy symptoms hit, it's also worth taking a step back and thinking about the bigger picture.
Exactly. Allergies are essentially your body's way of overreacting to something it perceives as a threat, even if it's as harmless as pollen. So beyond medication, what else can you do to minimize those triggers in your environment?
Right.
Maybe it's investing in a good air purifier, changing your bedding more frequently, or even being mindful of the times of day when you're outdoors. Every little bit helps.
It's like that old saying, an ounce of prevention is worth a pound of cure.
Exactly.
Well, there you have it. We've thoroughly unpacked Ketotifen, giving you the knowledge to tackle those itchy eyes with confidence. Until next time, stay curious and keep exploring new ways to take control of your health.